Hi guys, my name is Sarah Myers and this is my academic case study speech. I am choosing the academic case study entitled A Conservative Physical Therapy Approach for a Child Who Toe Walks, a Case Study. I am thoroughly interested in this case study to learn the approach for correcting children who toe walk. I have a personal connection as my cousin toe walks and always has since she was little. I think people are generally interested in learning about why this problem occurs. I am intrigued to learn and share some solutions to this improper form of walking. Throughout this speech, I will identify the problem, some solutions in play today, and the outcome of this specific case study. So I'll start off with the problem. As stated by physical therapist Didier and Dr. McQuaid, this case study follows the rehabilitation of an 8-year-old child who toe walks. This child had received physical therapy at the age of 3 for toe walking, and after only 3 months had mastered flat-foot walking. The parents started getting concerned when the child reverted back to toe walking when he was 7.5 years old. Toe walking can be simply defined as walking on your tiptoes 24/7. The cause of toe walking can be due to a number of reasons. Didier and Dr. McQuaid mention that sensory processing dysfunction, premature birth, and muscular weakness are all causes of toe walking. The solution process has a number of different dependents, the first being the cause of the disorder. The plan may change due to the reason that this disorder occurred. The age of the patient is also taken into consideration. The older the patient and the longer the disorder has been is also taken into account, which then leads to less likely seeing progression of the major improvement needed. This walking disorder can have a very low rate of improvement after the patient has reached the age of 6.5 years old, due to the bones in the foot fully developing. This most likely results in the child reverting back to the history of use, meaning the child's bones in the foot may have developed wrong, making correcting toe walking harder. Some good news mentioned in the case study is that most toe walking patterns resolve themselves. Many of the recorded cases are due to parental concerns and physical activity concerns. Solutions that are greatly considered in toe walking cases that are not self-corrected are typically surgical plans. Dr. McQuaid and physical therapist Didier believe this is the last chance action to take place. Statistics even show that 63% of surgical plans don't resolve the issue. Looking back at the title of this academic case study, we notice the phrase conservative physical therapy approach. The progress plan set for this 8-year-old boy with toe walking disorder was just that, conservative. The specialists didn't look right into surgery to correct, because physical therapy was a better solution. A mixture of stretches, strengthening, desensitization techniques, and physical activities were used. With physical therapy 2 times a week for 16 weeks, and then once a week for another 12 weeks, the patient saw improvement with his walking. Not only did he mention that he felt he was walking more flat-footed, but also his parents and school administration people at his school also mentioned as well. The treatment plan focused on getting the patient to feel more comfortable walking on flat feet. The outcome was that the conservative approach was very beneficial. The patient's range of motion in his ankle and heel were significantly improved to where his toe walking ceased to exist. Without the surgical approach that the parents deferred from, the problem was non-invasively taken care of. After learning about this academic case study, I was relieved that the conservative approach worked. I liked the idea of using stretches and strengthening important muscles to reverse the disorder rather than surgical plans. I hope you found this information just as interesting as I did. Thanks to Dr. McQuaid and physical therapist Didier, maybe this case will be referenced as a treatment plan for other patients with the same symptoms of toe walking. Thank you. Bye.